So in this lesson, we're going to talk about adjunct neuro assessments. Now, these are assessments that you can add to your routine neuro exam if you need more information or you want to go into further depth. These are especially helpful if your patients have abnormal findings on their routine exam. You can get more information with these. So we use the adjuncts to determine further severity of neurological deficits and sometimes to rule out certain causes of problems. The most common adjuncts that we usually do are the brainstem reflexes. Now, the brainstem reflexes are kind of your basic core things that your brainstem will help take care of. One of those things is breathing, but then the three main things we look at are cough, gag, and corneal. So to assess a cough, if you have a patient who it does not have an advanced airway, we're essentially just going to determine whether or not they'll cough. But if they do have an advanced airway, like an endotracheal tube or a tracheostomy, we can actually stick a suction catheter down into their lungs and it'll come right down into their bronchi. And usually that will elicit a cough because it's irritating. So if we do that and they cough, we know they have a good cough reflex. The other thing we'll do is a gag. So you'll take usually your Yawn-Cower and you'll put it straight to the back of their throat, behind their tongue, and touch the back of their mouth, the back of their throat. Usually that will make them gag. We want to see both a cough and a gag because anybody who doesn't have those two is probably going to struggle to protect their airway. So especially if a patient comes in unresponsive, you really need to make sure that they are able to protect their airway. And the third brainstem reflex that we would check is the corneal reflex, which is the blink reflex. So what you'll do is you'll take a wisp of a cotton swab or the end of a cotton-tipped applicator, and you'll just lightly touch it to their cornea, and they should blink. If they don't blink, that is a bad sign. Now, the other three assessments that we're going to look at quickly are nuchal rigidity, Babinski's reflex, and doll's eyes. So when we talk about nuchal rigidity, we're usually looking at meningitis. Now, nuchal rigidity, nuchal refers to the neck, and obviously rigidity means it's stiff or neck stiffness. Now, this isn't just like I worked out yesterday and my neck is stiff. This is really significant stiffness. This is the inability to flex the neck forward at all because the meninges around the brain and spinal cord and the central nervous system are causing irritation. And so usually what we'll see is when the patient is lying on their back, we will try to lift their head forward and bend their neck, their chin to their chest. And we'll either see that like their whole torso and their shoulder comes up with it, or their knees will pop up towards their chest. That is called Brudzinski's sign. If you try to tilt their neck forward and their knees pop up to their chest, that means that there's so much rigidity in there that it hurts them to bend their neck, and they're going to pop up to the chest. Their knees are going to pop to the chest to try to relieve some of that tension. The other thing that we might see is, again, when they're laying flat on their back and we bend both of their knees. If we try to straighten one leg, we're going to find that it's almost impossible to get it all the way up without pain. So they just can't, we cannot get their knee to extend passively. All of this is so stiff within their back and in their neck that it just doesn't move. So that's nuchal rigidity. Again, if you have a patient who comes in with things like a headache, high fever, altered mental status, try to tilt their head forward to chin to chest and see if you see any rigidity. Now, we'll talk more about meningitis in the meningitis lesson, so make sure that you check that out. Babinski's reflex is what we call a primitive reflex. It's actually normal in babies under 2 years old, but after about 2 years of age, we should see it disappear. So anytime after that, you don't expect to see this. So what you do is you can take something like a reflex hammer, and you're going to stroke the outside of the foot upwards and across the ball of the foot. And what you should see is like what you see here, where the toes are going to curl inward. If you remember when we talked about posturing, anytime something curls inward, that's like a protective measure. And so that would be a normal finding. This would be a normal expected finding. It would be considered a negative Babinski test. Now, if you do that same stroke and you see that these toes flex outward and they fan out and extend, that would be an unexpected finding, and this would be considered a positive Babinski sign, which is a bad sign. It's usually a sign of neurological disorders. Some of the common things that might cause this are brainstem lesions, meningitis as well can cause Babinski reflexes, any kind of neuromuscular disorders, especially spinal cord injuries, and then strokes. Now, not all neurological issues are going to have it, but you can bet that if you have a positive Babinski reflex, there's something neurological going on. Things that will not create a positive Babinski are things like drug overdoses, hypoglycemia, and any kind of metabolic conditions. So essentially, if the patient comes in unresponsive and you do a Babinski and it's negative, then you know that you may or may not be dealing with a neurological issue. But if it's positive, again, you know it's neurological. Now, doll's eyes reflex is something that we'll see tested when we suspect something like brain herniation or brain death, which we'll talk about both of these in a later lesson. So we test this by turning their head side to side. So this is only done on an unconscious patient or unresponsive. And what you do is you're going to physically hold their eyes open and you're going to turn their head from side to side. And what you'll see if this is considered negative is that their eyes will stay straight. So this is like if you were to look at one spot on the wall and turn your head side to side and your eyes stay looking forward. So the eyes stay straight when you turn the head. What's happening is the muscles in your eyes are moving your eyes so that you can continue to focus on one spot. That would be expected. That's a normal finding for the eyes to stay looking at the wall. A positive doll's eyes reflex and the abnormal finding would be if the eyes move with the head side to side. And we call it the doll's eyes because it's as if they were painted on. If you have a doll and the eyes are painted on to the doll, when you turn this doll's head to the side, the eyes are going to go to the side with it. Everything's going to move at the same time because everything's painted on. So if you have a patient where you hold their eyes open, you turn them side to side, and the eyes go with the head, that is considered a positive doll's eyes, which is a very bad sign. And again, a positive doll's eyes is likely some sort of brainstem herniation or possibly even brain death. Now, this is kind of a hard one to describe, but the first time you see this, you will understand it. So just remember, these adjunct tests are there for us to help determine the source of the problem or the severity of an issue, and we add them to our routine assessments to get more details. We check basic brainstem reflexes like cough, gag, corneal. Patients who are in a coma who still have brain activity will still have these reflexes. Now, if we are concerned about possible meningitis, we'll check nuchal rigidity. Again, try to lift their chin towards their chest and see if their knees pick up or if they're unable to bend that neck. And that's how we see that. Babinski's reflexes, anything greater than 2 years old is considered indicative of some sort of neurological issue. And then the doll's eyes reflex is something that we check if we're concerned about any kind of loss of brainstem function. Make sure you check out the brain death lesson as well as the intracranial pressure lessons to learn more about when we would use this specific test and other ways that we would work to confirm brain death. So use your clinical judgment, determine which of these adjuncts you may or may not need to add to your neuro exam, and you are going to be super impressive in clinicals if you ask about and test the patient's Babinski reflexes. Now, go out and be your awesome selves today, and as always, happy nursing.